Hi, my name is Daniel Jensen. I'm the Associate Director of Public Health here at Olmsted County Public Health. We're a local public health agency working in southeastern Minnesota, one of 11 counties covering this region. And we've worked together with our local medical providers for many years in a community of practice on issues such as immunization registries, such as smoking cessation, and other types of similar issues. Most recently, we've been working on the Beacon Grant together as a community. We discovered that the importance of really getting early notification out to community members when one of their clients have been hospitalized. Our long-term vision is to have a ADT feed that goes out from the local providers to each of the medical providers, and then at the point of hospitalization, they would match the client who's being hospitalized to that ADT feed. The case manager then will be able to become involved at the point of admit, working on the discharge plan with the hospital, bringing the community focus to the medical provider and working together on a client-centric plan of care. But more often than not, we're not finding out till weeks or even sometimes even months after discharge that one of our clients has been hospitalized. And at that point, the ability to impact that plan of care and to connect them with community resources, we've missed that initial work on there, and sometimes that can be detrimental to the long-term health impact and increase overall cost for those clients. And what we're looking at doing initially in the pilot phase is providing an ADT feed out of Olmsted County Public Health to one provider within the community, Mayo Clinic in this instance, and that one-to-one connection will allow them to initially have a notice that will occur on the Mayo Clinic side, and we'll receive a paper or a telephone call notice of that. We're going to turn that into an electronic feed, and then our intermediate plan is to roll that out more widely across all of the southeast Minnesota agencies. And we believe that once this is in place, we'll be able to determine what the impacts are over the long term with these clients. And if we're able to see improvements, then we'll be planning on talking to others about some of these results, these very exciting results in the future.
I'm Lindsay Davis, a public health nurse with Olmsted County Public Health Services, and my role is to provide case management to elderly and disabled individuals in the community. An elderly female dementia client who resides out at Sunrise Cottages Assisted Living in Rochester. She was hospitalized after a fall which caused a fractured hip and needed hip surgery. The social worker from the hospital contacted me as her case manager and involved me in her discharge planning from the start. We were able to get her into a dementia-specific nursing home unit where she could receive her therapies, but would also be able to have the cares necessary for her dementia. Had I not been involved, the hospital would have discharged her to a regular nursing home unit, and most likely she would have become delirious, and with them not being able to handle those types of behaviors, she would have ended up back in the hospital again. I do feel that my role made a difference in her discharge, and I'm hoping for a great outcome for her.